Working in a public health, sexual health clinic is such a unique experience because we are really at the nexus of clinical care, public health programming, and then also integrating in research.
I can remember as far back as being 15 years old and remembering that I wanted to be a women's health nurse practitioner, but I specifically wanted to work in STD.
My job is a combination of actually getting the information out of our kind of antiquated health record, and then tallying that up and being able to report it, and in some cases analyze it.
Compassion is a really good strength of this job, because if you don't have compassion for these people, you should just leave. You can't judge.
The rapport that you meet with a patient is like super intimate. You are learning about the most intimate details of their life.
A lot of times people are they're nervous. They're nervous, especially if I have to look at certain body parts. No need to be nervous. I do this every day. I like what I do, and I want to do this because I want to help you.
It takes wanting to have to ask the tough questions, whether it's, how did you end up with this partner? Tell me a little bit more about what was going on in that situation. Do you feel safe in this relationship?
This is sometimes the only space that people are going to talk about their sexual practices and what they're doing.
Patients tell me things like, I've never told anyone this before. I've never shared this with anyone.
A person having an STD is the least of their worries in some cases in some parts of this neighborhood. They may be worrying about, how am I going to eat today? How I'm going to sleep?
See yourself in the people who come into the clinic, because at any point you can be without insurance, you can be without food, you can find yourself in a vulnerable situation.
I know we've made a difference in people's lives when we get people back on their HIV meds. When we treat them for syphilis that had been left untreated for years and years.
It's very cool to know that you help this one person, and then that person may give you 10 partners, and you find those 10 people, and those 10 people give you another 5 people each. To know that you possibly could have helped 50 people in the course of let's say 2 months is awesome.
We really try to, be there when other services or solutions have not worked out for that patient, and try to go the extra mile. And that really is what draws a lot of people to be working in the clinics.
I feel like out of all of my friends who are nurse practitioners, I have the most rewarding job.
And to help people will always be a passion of mine.
This is my purpose in life, to be able to talk to people and to treat people.
Disease affects things in predictable ways. So if we can find the patterns and we can start putting interventions forth to interrupt those, we can decrease disease, and that benefits all of society.